Great. Thank you so much. Good afternoon and good evening, everybody, and a very warm welcome to the live information session about the leadership journey with East Africa and India Fellows. I'm Avantika. I'm a program lead here at the WomenLift Health India team. We are delighted to have such a diverse group gathered here from across both India and East Africa, coming together for the first time for us with a shared commitment to leadership, learning, and impact. Today, we'll introduce to you the Women Lift Health journey through the voices of our global fellows, alumni who have been part of the journey and have completed the year-long program, who will share their experiences, challenges, and achievements with us. Before we start, I do want to mention that today's session will be recorded only so that it can be shared back with all of you later. So thank you and welcome again. Purvi, can we just move on to the next slide, please? Thank you. So just to take a moment and talk a little bit about why are we all here and why is it important to talk about women's leadership? I think all of us come from public health. We know that women form the backbone of health systems worldwide. They hold nearly 70% of health worker jobs globally and make up more than 80% of the nursing and midwifery workforce. And beyond the formal health sector, we also know that women are the primary providers of unpaid care and domestic work within families and communities. And they often serving, as the first point of care for children, elderly, and the sick. And despite kind of this overwhelming presence and this indispensable role that women play, they remain significantly underrepresented in decision-making spaces. As we know, only about 25% of senior leadership positions in the global health sector are held by women. This is a stark imbalance, and it highlights a persistent gender gap where those who deliver and sustain health services at every level are rarely in decision-making tables or are the ones kind of shaping policies, strategies, and investments that guide the sector. And as we know, this disparity is not due to the lack of capability or ambition. We're all sitting in this room together. We have very ambitious global fellows, but also all of you as the audience members in public health. But it is rather a result of multiple systemic and social barriers that prevent women from advancing into these leadership roles. If we could just go to the next slide, Purvi. So we at WomenLift Health conducted a study as part of the Lancet, and we collected and analyzed information from working women in public health, both in India and in East Africa, as well as in North America. And this was to sort of understand and document the specific enablers and barriers to women's leadership. Our evaluation found really interesting overlaps in the top 3 barriers to work for women in public health, specifically across India and East Africa. Despite women, and I think if you see just on your screen, despite women in all regions emphasizing the importance of mentors, for instance, nearly a third of women in East Africa said that a lack of female mentors or role models was one of their top 3 barriers at work. And similarly, in India, about 20% of the respondents from India also reported this as one of their top 3 barriers. If you again see the second one around gender discrimination, I think women in India frequently described facing casual, routine sexism in their jobs. And in East Africa, approximately half of the women in the survey also saw gender discrimination as one of their top 3 barriers at work. So a lot of overlaps, I think, in the kind of challenges that we see across India and in East Africa for women's leadership. And the third one, which is around family responsibilities, was the most frequently chosen professional barrier in East Africa. 56% women chose that. And frankly, even in North America, where 50% of the women said that that was a constraint or a barrier for them. While about 38, 39% of women in India identified harmonizing personal responsibilities with work as one of their top 3 professional barriers. And so all of this to say that I think collectively as women in public health, we are fighting against some sort of barriers right now that are systemic and social in nature. And if we could just move to the next slide, Purvi. And so, having recognized some of these deeply ingrained challenges, we at WomenLift Health have committed ourselves to expanding the power and influence of talented women in global and public health. If you see the theory of change, it's based on advancing accomplished mid-career women to senior positions in public health, and eventually kind of lead to improved health outcomes as well as advancement in gender equality. And this work that we do of advancing equality in health leadership is delivered through a range of actions at the individual, institutional, and societal levels. This particularly includes the 12-month leadership journey, which we're all a little bit familiar with, hopefully, which focuses on equipping mid-career women such as yourselves with the tools and resources to successfully use their voice, expertise, and leadership for impact. And if I could just take a minute and talk a little bit about the leadership journey. Next slide, Purvi. Is essentially a 12-month learning experience that focuses on giving mid to senior women in health one, I think just a safe space to explore their authentic leadership through vulnerability and reflection, an inclusive and diverse network, which fosters a sense of belonging. They get through that 1 year tools and strategies for enhancing their voice and influence, and all this while being supported by a powerful group of peers, mentors, and coaches. As all of you know, our applications are open right now, both in India and in East Africa, and the due date is October 10th. Through the panel, we're going to hear a lot of the global fellows talk about some of their experiences and some of the things that I just mentioned. So we'll have to wait for that for a minute. Your moderator for today, next slide, Purbi. To kind of bring up some of these conversations is Sandhya Gupta. She's a Global Fellows lead and manages the 400 plus Global Fellows across India, Africa, and North America. And with that, I am going to introduce your panelists for the day. Next slide, Purbi. Thank you. This is in no particular order. The first panelist is Jacqueline Kilimanda. She's a program management specialist, HIV quality of care, USAID Tanzania. She's a WomenLift Health Global Fellow from East Africa 2024 cohort. Jacqueline Kalimunda is a highly accomplished and dedicated health domain expert with a particular focus on enhancing the quality of care and treatment for HIV/AIDS. Currently serving as a quality of care and treatment specialist with USAID Tanzania, Jacqueline plays a pivotal role in providing technical support and oversight to USAID's HIV/AIDS and tuberculosis projects. Jacqueline collaborates with the Tanzanian health system at all levels, including government agencies, partners, healthcare teams, and beneficiaries, including children. She has successfully led management of 2 complex integrated health programs that results into improving lives of mothers, adolescents, and children in Tanzania. We welcome you, Jacqueline, and thank you so much for giving us the time today. Our second panelist is Dr. Kusum More. She is the Executive Director, Stree Arogya Rural Foundation. She is a WomenLift Health Global Fellow, India 2023 cohort. Dr. Kusum V. More, MD, is the Executive Director of a nonprofit organization, Stree Arogya Rural Foundation, SARF. SARF aims to improve the health and well-being of rural women in the state of Maharashtra, India. She has more than a decade of experience in community medicine, primary healthcare, public health, and women's health. She has over 15 scientific publications in peer-reviewed journals, and most of her written and published work is in women's health. Kusum is also a passionate poet and writes poetries on topics related to women and gender equality, for which she has received many accolades. Thank you, Kusum, for being here. Our third panelist is Dr. Millie Kagwa. Dr. Millie Kagwa is Women's Health Lead, Population Services International. She's also the WomenLift Health Global Fellow, East Africa 2022 cohort. Dr. Millie Kagwa is the Women's Health Lead at Population Services International. She is a medical doctor and public health professional with over 18 years experience in both clinical settings and NGO settings. She has seen and been a part of the SRH and MNCH growth in Uganda, contributing to the introduction of new contraceptive methods, especially in the private sector in Uganda. Previously, she was the programs director at PSI Uganda and as the quality assurance regional lead for East and Southern Africa, where she provided leadership oversight and technical assistance, helping PSI to achieve remarkable success in building public and private sector capacity in SRH, FP, family planning, and maternal and child health programs in Anglophone Africa. Thank you so much, Dr. Millie, for being with us. Our last but not the least panelist, Dr. Pallavi Kshetrapal, is an associate professor, Translational Health Science and Technology Institute. She's a WomenLift Health Global Fellow, India 2024 cohort. Dr. Pallavi Kshetrapal is an associate professor at the Translational Health Science and Technology Institute, India, where she leads research in maternal and child health, placental biology, and clinical metabolism. Dr. Kshetrapal also heads the THSTI Biorepository, one of India's largest clinical biobanks with over 1.6 million biospecimens, which supports cutting-edge multi-institutional research. With over 40 peer-reviewed publications, Dr. Kshetrapal continues to advance translational research to improve outcomes for mothers and newborns. Beyond her research, she has actively contributed to capacity building in India by training young scientists, developing biobanking standards, and fostering collaborations between clinicians, laboratory scientists, and data scientists. Thank you so much, Dr. Pallavi, for being here with us. And with that, I'm going to pass it on to Sandhya to take over the panel. Thank you.
Thank you so much, Avantika. And hello, everyone. Greetings from Washington, D.C. It's so wonderful to be here with you all today, to see so many folks in the audience, and to also be joined by our 4 extraordinary women for this panel today. To kick us off, just a few housekeeping rules in terms of how this session is going to run today. So this session will be split into 2 sections. We'll start with a moderated discussion with our 4 WomenLift Health Global Fellows, followed by an audience Q&A. In terms of submitting and asking questions for the audience members, following the moderated discussion with our panelists, we will take questions from the audience about leadership journey experiences, program details, and the application process. You may submit questions by typing them along with your full name directly in the Q&A box at the bottom of your screen. For any questions directed at the Global Fellows, I will do my best to ask your question live during the Q&A section. For questions regarding program details and the application process, one of our staff members can respond to you directly in the chat box. Please feel free to submit your questions throughout the entire session. All questions will be taken during the live Q&A section of the session. You can also raise your hands during the live Q&A and wait for us to unmute you. So with that said, I'd love to kick off our panel today, and I'm going to start with a question to Jackie. So Jackie, what was the understanding you came into the program with about women's leadership, and how has that evolved with and after your WomenLift Health leadership journey? Thank you.
Thank you so much for the question. I hope you can hear me clearly. Good morning, good afternoon, everyone. When I was applying for this leadership program, I was intentional in very targeting to enhance leadership skills that would have addressed the leadership challenges that I was facing at work. I had attended a number of leadership courses already, which were short courses, which were giving me theories and not getting enough commitment, accountabilities in applying the theories that would have earned from those short courses. But when I looked at the WomenLift Health Leadership Journey, particularly the roadmap, it really attracted me and really informed me how I will be transformed. Working as a program specialist for 10 years at USAID, leading a health portfolio worth of more than 50 million, which is implementing very complex integrated health programs. I was very busy, very engaged with the mid-level health professionals from different levels, and also leading a large team, complex technical area, extended geographical area. So the barriers that I was facing was going unnoticed with less influence. So the achievement, the good program achievement, we are going, all the credit we are going to the implementing partner, and I was left unnoticed. And even my influence, also I was feeling that I would be more influential in the room, giving technical directions, but not outside the discussion rooms. So I felt I need something that will give me that opportunity to go visible, to go noticed, and my voice get heard. Also, I felt I need to understand myself more. I need to know myself more than the way I know myself. So when I saw the authentic leadership, then I said, this is the right place for me, where I will be able to know myself better. And also, as I said, the areas that I was working with the mid-level managers. I felt that I'm doing a lot, and I'm able even to improve my advocacy and persuasive skills to be able to meet high-level managers like the Minister of Health, the Permanent Secretary, and be able to advocate, to persuade the challenges that I'm facing in the field that are not that I need to share with my supervisor or my director for them to inform these high levels. I say I could do it myself. Why should I use other people to speak for me? And lastly was to expand my network. I felt like I'm only known in Tanzania in very few platforms of public health specialists. I need to get out. I need to be in the world. And then I said, these need to take me, and I have to join this program because I believe it is going to help me to achieve all these thirst that I had. So how did all evolve during the journey? Immediately, starting with the immersion, the 3 days, I was enlightened. My voice was enriched. I felt empowered and even transformed only for the 3 days because I was equipped with the information, the evidence from the world, the different tools that could be used to improve my leadership skills. And I liked the statement that there's nothing wrong with me, and the program is not there to fix me, but it's only to transform on how I see things, how I imagine things, and ensure that I can be able to communicate and be open and share my understanding. So that empowerment really gave me the power to go out and show who I am. The other thing that I got from during the journey was the tools that were used to assess and know myself. The 360 tool, the Big Five, and many others. I can't mention all, but these tools, they left me with the aha. So this is how people are seeing me, and this is the way I see myself. I got that opportunity of comparing how I see myself and how people are seeing me. But the biggest thing that I got from these tools, I was able to see the areas that I need to improve in order to achieve where I want to go, but also use the strength that I have to do even more. The touch points were a very exciting moment for me. I would wait for the touch point session because they were so informative. I would learn from others, experience from others, from Uganda, from Kenya, not only Tanzania. So they left me informed, but also identifying areas that I could improve. And the beautiful part of this journey, it was the coaching. I was attached to a beautiful coach where I was able to pour my heart and share all that I'm facing at work and how can I improve the way I'm operating. And I love the coach, the way she was not judgmental. She was there listening and challenging me and reminding me and sharing a number of materials to improve my areas where I was facing challenges. But also she empowered me, like, you are good on 1, 2, and 3. You are not like the way you are assessing yourself. So real. And until today, we are still in touch and communicating. In the other part was the mentorship, where we were put in a group with other fellows. So we get to learn from each other the whole year, particularly when we are developing our project, the leadership project, but also different challenges that we are facing at work. So it left me with sisters where I can communicate and get solution quickly. The program project, it gave me all that I wanted because it gave me a platform to practice what I've been learning in the journey. Because it really pushed me out of my comfort zone and took me to a level where I met with the high level minister, I met with the stakeholders. So it really gave me challenge to practice most of the skill that I learned and even gained the influence that I wanted, that I really aimed to get. So in nutshell, that's how things evolved throughout the journey. I will let others to come in and share the experience. Thank you so much, Cynthia.
Thank you, Jackie. I especially appreciated how you mentioned immersion, the first in-person residency, and the 3 days of transformation, because that is always a very positive memory that comes back. So thank you so much for sharing your thoughts. The next question I'd like to ask is for Kusum. So Kusum, you have worked on a variety of health issues across private and government organizations. What have been some of the consistent challenges you have had to face at the workplace? And how has the leadership journey helped you in navigating some of those challenges even 2 years later? Thanks.
Thank you, Sandhya, for that question. When I think about working across different sectors in different states in India, and I realized during the program that this is a consistent and quite common thing that most of us face at work. To summarize, to put that in one word, I would use the word conflict. And conflict need not be loud. It need not be problematic always. Conflict is basically something we all face when we interact with people, and there is a difference of opinion or a difference in approach to something we want to get done. So that is something that to basically summarize that word, and that I think spans across the many challenges we face at the workplace. So how did the leadership journey help me navigate conflict during different circumstances and different situations? As Jacqueline mentioned, we were during the journey, we took a range of assessments, self-assessments, which we did online, virtually, as well as our peers, our superiors, our bosses, and the people who report to us assessed our competencies in leadership. So we had a range of reports. I actually went back to the resources I have and counted, we have 200 plus pages of worth reports about our own personality as well as workbooks where we have space to reflect on who we are as a person and to look inside us. So these are basically psychometric assessments. One of them was to understand how we deal with conflict. What are our tendencies? What kind of approaches we use to deal with conflict at the workplace and even at home for that matter. So that was extremely new and interesting for me. Constructive conflict responses and destructive conflict responses. So that was amazing. What is good about great about the leadership journey is that the whole year we are discussing these reports with our coaches and through the virtual learning touch points and discussing them, reflecting on them, helps us internalize that information. A lot of that information may be something we already knew, but has been brought to the surface. A lot of the times we are not self-aware. We are not aware of how we are reacting, how are we responding, how others perceive us, etc. So that experience was key. It was instrumental. I have carried that forward, and it really has transformed me. The way I deal with conflict, I am a very reactive and responsive. I'm very reactive as opposed to responsive. I do not pause before I respond. So that is my personality. And even just knowing that, understanding that, and seeing what could be done differently has helped me a great deal at the workplace as well as at home. To summarize my response to Sandhya's question, a consistent challenge that I have faced and all of us face at work is navigating conflict of any kind. And the journey really helped me transform the way I deal with, the way I look at conflict also for that matter. Uh, Another thing I would like to add is through the sessions, when before applying, I would look at people, let's say, and say, oh my God, this is such a senior person with a lot of years of experience, with a very heavy job title in an amazing organization. And that would be that would be a subtle barrier in me approaching them, for instance. That barrier was removed through this program because I realized that when for example, my mentor, a coach is, we have a coach, which is a one-on-one during the program. And we also have a mentor whom we have group discussions with. So the mentor is a famous personality. In my case, it was somebody I had always looked up to for many, many years. And when I had these sessions with her, I realized that when you keep the designation and the title, what level of management the person is aside, we're all very similar and have gone through similar experiences. That was another key takeaway. And again, that helped me navigate how I work because that was a challenge for me that, I looked at people with who are in high top level management, and there was a subtle barrier in me approaching them for whatever work I wanted to get done. So these two things, I think that sums up my response to you, Sandhya. Thank you.
Great. Thank you, Kasum. The conflict dynamics profile is also one of my favorite assessments because, as everyone knows, there will always be conflict in the workplace. And it's so important to understand how to navigate that. So thank you for bringing that out as well. Just one note to the audience, there are questions coming in, and that's fantastic. If you could type any of your questions through the Q&A box tab that's at the bottom of your screen. If you can submit questions through the Q&A channel, that way everyone can see the questions, and so we can be sure that everyone can also see the responses. So thank you so much, Kasum, for sharing that. My next question is for Millie. Millie, what has been the transformative impact of WomenLift Health for you? What are some of the changes that you have witnessed in the teams that you have led, and how has the journey in this community supported you in that? Thanks.
Thanks, Sandhya, for that question. When I joined WomenLift, and I think I was in the first East African cohort, this was right after COVID. But if you remember that period of COVID, there was a time when we were not really traveling anywhere. So we're stuck in our little rooms. And at that time, I was working as a technical advisor alone in my house. So every morning I woke up in the house and talk to people on the screen the same way we're talking here. But that human interface was missing for me. At that point, I had one person who I supervised. So when I joined I didn't set out to join WomenLift, but at that time there was in my cohort, it was you are invited to apply, and the invitation came from previous cohort members. So I had two invitations from two amazing ladies in the Northern American cohort who recommended this training. So I thought to myself, by the time both of them, two different people, one of them was not in my organization, are recommending this. This must be something interesting. So I did apply, and I didn't apply to build my skill set, but I saw WomenLift. This must be really good. So one of the things at that time, I had one person who I was supervising, and the question that I kept asking myself in my little room was, where is my team? Do I have a team? Who am I leading? Where is the leadership? Because previously, before this technical leadership job I truly had a huge team of maybe 5 people who were reporting to me, with 10 people reporting into them. And that was like a real team. So for me, what has been transformative about the WomenLift for me personally is the fact that I was able to lock into the concept that leadership starts with me. Leadership really is about me. It's not necessarily about the big team, the people who are reporting into me and making sure that they reach their goals and targets, but it's about me knowing who I am, knowing where I'm going, knowing what I want, and getting the skill set to do that. So everyone, Jacqueline has talked about, the previous speakers have talked about the tools, the 360 tools, the profiles. The profiles were very, very helpful in helping me at a point where I was a little disillusioned about what leadership is, to realize that yes, even without a team, you are still a leader, because you have to lead yourself. And once I got that, I'm leading myself, and where do I want to lead myself? I was able to then pursue the things that I love to do, pursue the work that I love to do. And as we speak, my team has grown from 1 person to maybe 5, and they're around the globe. And the WomenLift journey was helpful in helping me to now navigate and use all the other previous skills that I've had when my team grew. And this becomes very interesting when you have a team which doesn't, I mean, in the work that I have mainly as an advisor, you don't have the final say to make anyone do any work. But if they don't do work, you are measured on that kind of work. So even what is transformative is how to then get the goals that I have set, or that are set for me, using the skill sets that I developed using in the journey, to actually get that work done in a way which is satisfying for myself and satisfying for my teams. So that's what I have seen again and again as my teams have grown, as the people I work with have grown, and they are different. I'm in East Africa. I come from Uganda, and the culture in Uganda moves with you to the workplace. And when you're working with people from a different culture, then you see those differences. You know, when you're working with someone from Northern America, they are very open, they're very loud. And when you're working with someone from another culture, sometimes they are going to wait for you to ask them things. So knowing that and knowing who I am, I've been able to say, when I'm working with people who, for instance, are a little bit more they're out there, they speak a little bit louder, they are not worried to represent their views, then I have to transform myself and say, I'm going to call on my assertiveness, which is what we were talking about in the leadership journey. I need to build my assertiveness in this particular environment to be able to lead this team in a way that they will respect. So that has been for me the transformative pieces of the journey, knowing when to pick which pieces of the many leadership skills that we were taught, which one are you going to use when you're working with this team, with that team? And that has been helped me to grow my teams in a way that I believe is authentic leadership at its core. And how has the journey supported me? I feel plugged in. I know that the WomenLift Global Fellows now has a family, and in that family you will find, at least I find, a lot of people, women just like me, like-minded, ready to help with another, to help another person. And and I've found that it has been that journey helping me. For instance, when I go to, I just reached out to Sandy and said, do you know anyone going to ICFP? And I know there's going to be a family, there's going to be people in that space who are public health specialists who are interested in, who have also gotten into the movement of women lifting, others who I'll be able to tap into and have those discussions with. Sandy, I think that's my response to your question. Thank you.
Absolutely. Thank you so much, Millie. And I love how you talk about the ability to accomplish your goals in a way that is satisfying for both you and also your team members, which means knowing how you show up at work, knowing how others show up at work, and navigating these complexities of a multicultural workplace as well. Just extraordinary. Thank you. And my last question is for Pallavi. And Pallavi, you have done some incredible work in diagnosing preterm births as part of your leadership project. Can you tell us a little bit more about that? What made you think of this issue as part of your leadership project? And how did the leadership journey compel you to continue to work on such an important problem for women's health? Thank you.
Thank you, Sandhya. Nice to hear from the other women leaders. And I'm not going to talk about how incrementally the WomenLift Health program really transformed me into, and my project into, something which I can now call successful. And I'll let you know in the summary how and why I say it's successful. So as a biologist, I was always interested into working out the biological mechanisms that our body is working with for anything that is vulnerable to women. So the point is, women become more vulnerable during pregnancy. And that is not all the vulnerability because of societal issues. There could be biological issues also because of the physiology that is changing in the pregnant women. So with that question, to understand what are the biological implications or the determinants of pregnancy complications like gestational diabetes, preeclampsia, or adverse outcomes like preterm birth. So in a nutshell, I was working on the women health during pregnancy and the neonatal outcomes. So that is where we thought that to understand this whole thing, you really need longitudinal samples. And here I would like to really appreciate the mentor who I had at THSTI is Dr. Shinjini Bhatnagar. She took up this major program on the, you can say, as a mission mode, led by Dr. Bhan at that time, where they wanted to build up a longitudinal cohort of 12,000 women. Now, the challenging thing was that they were the clinical team and I was the biologist out here. So this was Kusum just talked about a conflict. It wasn't a conflict. It was an amalgamation of ideas to move forward. So this biologist, immunologist, all moved together in a way that where I, as a women leader, and the leadership project that I wrote was to turn this biorepository into a national resource, not only to understand the questions that I always wanted to, but also the other people nationally and internationally, where they could use this rich resource, well phenotyped, clinically phenotyped samples, which are being stored in a biorepository, that is the blood, saliva, hyvaginal tissue of a single mother at different trimesters. So this is a huge resource. So based on that, I wrote a project where I wanted to understand what are the different metabolites, or you can say biological determinants of preterm birth. So this was my complete program. But initially, the point is that we need to have a biorepository. And it was very challenging in India at that time to have a biorepository because it needed resource. And also the challenge was that we need to have an internationally accredited biorepository. So the first challenge which came, I turned into an opportunity was we got the biorepository of translational health science technology, which has been funded by the government of India as one of the first biorepositories, which internationally is now accredited with ISO 20387, the only international standard that is there. Second challenge was that you need to have proficiency testing. How do you know these samples are really good and are not artifacts that you want to study the biology of it? So India, again, this biorepository is the only biorepository in India where we have 4 such proficiency testings which have been done from Luxembourg. So coming to the point where women health really helped me do this was it changed me as my perspective. And Kusum has already talked about that there were a lot of, you can say 250-page reports that were for us, how we are and how we take up the challenge. So it really helped us during the 1-year period. And also it changed my perspective to understand people. Instead of reacting to anything, I started responding. And the first thing that I did was in my email box, I'm sure you would all go back to see it, which I did see after this. In the Outlook, there's a provision that you can directly send a mail or you can have a 90-second pause. That really helped me. I used to write everything and then undo the message, basically not send it. It would go, but then again back to say that 90 seconds were there for me to respond rather than react. And I still use that. And I think that's a very beautiful thing that was taught to me at one of these sessions. And thanks to the women leaders for that. And in a summary, I would like to say that we need to unlearn things to make some space. We are already leaders, correct? That's why we come into the program. But to shine us as senior leaders who can be the torch bearers. And for that, I had to reboot. I had to reset myself, remove some of the junk which I had, and learn some new perspectives in my life, which I'm very happy. And I'm really happy to say that one of the attendees in this workshop now is going to be the next torch bearer. Vidushi is on this group, who is from the same department. And I think she's going to take the torch forward for all the incremental change that WomenLift is doing since ages to the new generation that is going to come up. Thank you so much for me to be a part of this program. And I was an invitee. That's how I got to know about it. And I'll talk to you about my aha moment a little later. Thank you.
Thank you so much, Pallavi. That was great. It's funny that you mentioned that space between the stimulus and the response. And I was just having a conversation with some colleagues about this yesterday, just reminding ourselves that we can take the time between stimulus and response. And it's just such an important learning that we need to practice again and again. So thank you for highlighting that. So thank you to all of our panelists. I have a question that I would like to throw out to all of you, because I know that we have many prospective applicants in the audience, including some women that have hopefully already submitted their applications, and we have the applications just around the corner. So I was hoping that you could just share with the audience some of your top tips for having a successful application to the WomenLift Health program. So this question is open to anyone who has some top tips that rise to the front for you.
May I go ahead and answer
Please,
that one?
please.
So when I think back to when I was writing my application, I was a new mother. My baby was 3 months old, and my mind seemed like it was in a mess. However, what I did was I took just an hour's break, and I thought about what exactly it is that I feel and what exactly it is that I want to get out of this program. And I think again, like my previous response, the key word was conflict. To this response, my key word is honesty. I was very honest and to a large extent vulnerable while I was writing that application. And when I look back, I think that honesty is what probably helped my application go through. So I think a key tip to the people who are writing their applications would be to write in a way that reflects who you are and what you want, rather than writing something that you think that the reviewers want to see. That's one tip that I would like. Thank you.
Great. Thank you, Kusum. Does anyone else have any top tips?
Yes, Sandhya. I
Yeah.
just want to follow from what Putuma said, and with the being real when you're putting in your application. I think what made my application strong was the fact that I wrote exactly what the problem I had was. Sometimes when you're writing, for instance, the leadership journey and you're making responses, you get tempted to make it perfect. And if you make it perfect, there's nothing to support. It's all well and good. But what was the issue that I felt was very important? For instance, in my work, I was doing at that point quality of care, but I really did want something that I wanted to include. I've always been passionate about women and girls. How do we then include some of the gender dynamics? So this, my leadership journey for me was something that I felt passionate about and I felt was a problem. So that when I was writing about where I saw gaps, they were really the gaps that I saw in my workplace, in my life, that I really felt that I wanted to address. So it made I believe it made my project a little hard, because it wasn't something that easily is fixed, or I've written it out in a way that it shows how brilliant I am. I wasn't looking for that. I was looking for, how do I get helped with this problem that I actually have? So I would say being vulnerable and being open about where you feel you are in which place are you when it comes to leadership will make your application stronger. Thank you.
Thanks, Milavi. Pallavi, you have something to add?
I had one thing to add, which I will echo with Millie. So you have to make it challenging. The point is, you have to push yourself. Because if you don't push yourself, you'll not know your capacity and your capability. You are born with an expertise, but you need to use it. So I would suggest whatever is challenging for you, even if you achieve after the journey 20% more than what you were, I think it's a success. So put something which always you dreamt about, but you think you would not be able to do it alone. Let me tell you, WomenLift Health has networking, has ways of getting that woman out of you, and you yourself will finish the journey. So I'm very appreciative of this program, but write challenging projects for yourself. Don't think that you need to finish it 100%. The first step is, if you have written it, you're already 10% into it. So that's my bit of advice.
Thank you, Pallavi. It's inspiring me to want to write an application just listening to you. Jackie, anything to add?
Yeah, I think my colleague has said it very well. For me, I would say the application is a little bit longer. So if you leave until the last minute, that's where you'll end up writing wrong things. It will be good if, I don't know, if you gave yourself time to go through the application form before, like 3 times, and think about the answers, such that when you're feeling them, you already thought about them. And there are times when you need to involve some of the colleagues to also help you with filling the form, identifying the areas. So I would say the last minute is not helpful, but don't give up, because what we experienced, there are people who were selected and also they dropped. I felt so bad about it. So you better think about it so very, because when you do that, you are leaving others who wanted those opportunities just because of you who didn't think about it through. Thank you.
Thank you, Jackie. Really important reminders on time management. So one last question for all of the panelists before we turn to some of the questions from the audience. What was a big aha moment, Pallavi, as you also referenced. What was a big aha moment for you during the leadership journey, or maybe a key takeaway, and how are you paying it forward with that aha moment, that key takeaway? How are you bringing that moment into your work, into the world, into your community?
And yeah, I could
Yeah.
start.
Okay.
Go ahead,
My,
Millie.
okay, my big aha moment is after I had my first coaching. I'm going to be very open. I always thought coaching meant that you're weak at something. So when I went into the coaching, I wasn't looking forward to it. I thought I'm not weak. I know my stuff. So the aha moment was when I realized that, oh my God, coaching is really important. So many times we move based on the times. I've been in public health for 18 years. At some point, you're almost on just automatic, remote. You meet in the morning, have your meeting, go to the next stage. If things don't change in your environment, you can potentially continue on that route, not achieving much, surviving within the workplace. Also, of course, we're juggling many things: parenthood, marriage, children, family. So you end up doing a lot of things on raw without thinking so much about, why am I doing this? Where do I want to go? And how do I want to present? So the coaching for me, I remember my coach asking me why I do what I do. And I looked at her and I thought, isn't it obvious? Someone needs to do it. But it wasn't necessarily, I had to ask myself, is this what I want to do? Is this where do you see yourself in 5, your own personal plan? She asked me, where do you see yourself in 10 years? I hadn't thought that much. I was thinking about where I was seeing myself the next week or the week after. Where do you see yourself in 5 years? And if you don't have a plan for yourself, because to be a good leader from my aha moment was, to be a good leader, I must lead myself. So if you're going to lead yourself from maybe whichever management area you are, women, we tend to hit that glass ceiling, especially when you get to certain leadership positions and there's nowhere else to go, and then you stay there because you don't have a direction. But if you do have a direction, you realize that I've reached my peak at this particular place. Maybe it's time for me to pivot, try something else. Or am I enjoying this? How can I make it more something that is satisfying for me? So for me, the coaching was a big aha moment. And after, because one of the things that we discussed with my coach was the importance of having that, we call it network. Network doesn't really bring it out. Having that community, having that movement that you're plugged into that has a similar vision to you. So after completing the leadership journey, for me, I really felt that, oh no, I still want to be, I still felt I needed to be attached in some way. I need to help others. I need to be helped and I need to be plugged in. So after completing the leadership journey and there was an opportunity to be an alumni, I applied for that because I felt this will help me to continue to interface with something that I found really profound. And it has been one of those that has helped me to keep to meet others. I was based in Kampala, Uganda. It's possible to meet only the people in your line of work. And they are not necessarily the people who will make the workplace very satisfying. You will not get a sense of what else is out there in the world. And for me, I have managed to get that by keeping plugged into the WomenLift community. Thank you, Sandra.
Thanks, Millie. Pallavi, would you like to share your aha moment?
So my aha moment began with being selected in the WomenLift Health. Because I put a challenging project, I knew I have nothing to do. They are going to help me now, make it into a dream. So that did help because they taught us about the conflict and how to negotiate and also how to maintain a work-life balance. So my husband was happy. My children, I have a 20-year-old, he was very happy. And last but not the least, you need to respond rather than react. And the last I would like to suggest is support of the allies. I had no ally, so I made students as my ally. So I have a lab where I have 6 beautiful, hardworking 7 students. So they became my allies. And this was all taught. I all had it in my brain, but I never perceived it the way the Women Lift Health program talked to me about it. It's all there. You just need to grab it. And I think, and give back in return much more that you learn. So that was my aha moment. I'm now just trying to return everything. So I think, like Millie said, that it's like you've reached a stage. Now, do you really need to go ahead or just pivot yourself? And I think I'll just like to pivot myself rather than going ahead. I'd like the others to go ahead and move ahead. Thank you.
Thanks, Pallavi. I like the catchiness of this phrase, give back, take what you learn, give back what you, or return what you, whatever you said. It was brilliant. Thank you for sharing that. Kusum.
I had two aha moments. Both again were realizations about me as a person. So I always looked at myself as so the one of the many assessments we did told us whether we were focused on work, on family, or on something else. The other, work focused, family focused, or other focused. I always thought I was dual focused, that is work as well as family. But after my assessments, what came out was that I'm other focused. So during my introduction, Avantika mentioned that I write poetry, and that's very something that was very close to my heart. And when I got that report, I just looked back at different phases in my life, and I realized that the way people perceived me, a core part of my identity was the other, and I was actually other focused and not work or family focused, and to put it that way. So that was like, oh, okay, this is something that the way I perceive myself is not actually what the truth is. So that was one aha moment. And the other one was we were asked to analyze our networks. How wide is it, how diverse it is, and how deep it is. And again, then I had always perceived myself as a people person with friends across the country and a few across the world. But when I did that network analysis with actually putting down dots on the map and then seeing how diverse it is, I realized that a lot of the people I'm connected to are from the same profession as I am. Diversity is not as much in terms of profession, neither is it diverse in terms of geography. And that again was an aha that I need to work on this. I need to get to know more people. The depth was there. I realized that my network had depth with connections I have. I was comfortable with them. I could approach them at any time. The depth was there, but the diversity and the width was not there. So again, that was something that I learned about myself. So these were two aha moments during the journey. And paying it forward, I have actively worked on that. And any professional space where people approach me with a question in their mind or with something that they want from me, I make sure that I give them enough time. And I have, for the first time in my life, started mentoring students and started actively offering what I have, bringing what I have to the table. And that's something I learned is key to achieving our shared goals. Thank you.
Thank you,
Also,
Kusum.
sorry.
Go ahead. Sorry, go ahead, Kusum.
I saw a question on the chat which said, how have the connections you made at during the journey helped you? What is amazing is that during my journey, my leadership project helped me transition from a full-time job as an assistant professor in a medical college in Sholapur, Maharashtra. I transitioned to a role that is not very common here, which is I along with another doctor, I started a non-profit organization to serve rural women in our area. So that is quite unheard of, where you already have a stable job and you're trying out something new, and in a non-profit space. So I'd made that transition through my leadership project. And what is amazing is that one of my cohort members works for a funding organization in India, one of the biggest conglomerates, Tata Trusts. And she connected me to the trust, and we are in the process of actually getting a large grant to realize our dream of working for the women. So my banners is the name of my organization, which is just 1 year old, and we are now in the process of getting a huge grant from Tata Trusts in our country to carry our work forward for rural women in India. So that's how amazing it is.
That's incredible, Kusum. Thank you for sharing that. Jackie?
Yes, I would like to share my aha moment during the journey was when I was going through the feedback from the 360 in Lend, how I scored against others. It was aha when I saw that I scored myself low while others scored higher. So it really made me think again how I'm underestimating myself than others, how they are seeing me. So I didn't end there. I went and have conversation with few of them and understand how they ended up scoring them me. So they gave me a number of scenarios where they saw that I was doing even better than the way I thought. It really encouraged and empowered me to get out of my cocoon and do even better and better. For example, this pushed me to participate in the global webinars, which I was not doing. So I will showcase the Tanzania best practice in the global webinar. About 5 of them I was able to participate and share the practice, which I was most of the time underestimating it and see like, there's nothing new that I can share there. But this time I was pushed to go and look for the best practice, ensure that Tanzania is also participating. But the other part which really came out beautiful for me was we had a partner who was struggling in performance in the office, and the management was looking for the solution how to improve the partner performance. And say, in our office, we have a strong person who can push that partner, ensure that they're able to reach their goals and target, and that is Jacqueline. I was like, no, they say, yes, you are the one. So I was given that partner and tell you in 8 months, the partner improved the performance because I used all the skills that I learned from the WomenLift Health. Very collaborative. I worked with the partner and ensure that we identify the barriers which we are pushing them down to ensure that we are working together to improve. In 8 months, things changed and I was happy with myself. Of course, I got the cash award, but what remained the most is how I was able to make that changes. Yeah, I think I will just share this and I'll continue responding where necessary. Thank you so much.
Great. Thank you, Jackie. Thank you to all the panelists as well. We've been able to answer a few of the audience questions along the way, but I'm going to take just an additional 15 minutes or so to get to some questions from the audience. And this is a great question that was submitted, and we get this all the time. Rendana says, since my work involves lots of submissions and deadlines, would you say that it's easy or not easy to juggle and also give your 100% to the leadership journey? So essentially the question around balancing what is probably a very full-time busy work schedule with the demands of the leadership journey. Would anyone like to take that? Sorry, Pallavi.
It is easy and tough. So I guess the first few would be a little tough because you're trying to get involved in it and how exactly it should be done. So there are deadlines here also. So everything, see, human works on deadlines. So if you're working for the other deadlines, take this as one of them. I think that's fine for you. So that's what we all did. But one deadline, which is very, very sure, which is going to be followed by the Women Lift Health, is a self video that you have to make. And let me tell you, that is the most challenging one. And that is done at the end of the program. And still, it's so challenging to do it. It's just 5 minutes talking to a blank screen. So that is something which I'll say, just keep practicing. And I think that's where I got my practicing, and I can talk for ends to meet. But yeah, take this as a deadline. See, Jacqueline is also smiling. I'm sure she also had this tough thing. So it's really a very unique experience that the Women Lift Health gives us. And it's like, you can see yourself in the mirror. Am I that? Do I speak like this? Do you think I've made the perspective clear to the other person? So that is one tough thing. But other things I would say, because I'm also a person who has lots of deadlines to meet, because we're working in women and child health, so deliveries can't wait. Correct. So if we all can do it out here, I think you can easily be able to do that. Yeah. So that's my nutshell.
Thanks, Pallavi. Maybe one additional panelist, just in the interests of time. We'll get through some of these additional questions, but I wanted to see if any of the other panelists wanted to respond to the question about balancing your professional duties with the leadership journey.
Yeah, I would like to share that. The good thing is the program is already scheduled. So they share the schedule ahead, like at the beginning of the year, such that it gives you the benefit of you scheduling your year and ensure that you are attending those sessions. But this is, I'm giving you, if you want to meet the deadline, whether it is because of this WomenLift Health or for your work, we need to build these systems. We need to build a system in what we are doing. If it is at home, you make sure that you have a system how they are going to ensure that they move along the day schedule. At work, the same, such that you get a life-work balance. Without the system, then we will end up with last-minute things and find everything difficult. But let's build the system in our lives first before building the healthy system outside. Thank you.
Great, thank you, Jackie. Kusuma, I was going to say, I saw you come off mute. Did you have something just to add to that? Sorry, Kusuma, I had seen you come off mute for the previous question.
Yes. Sorry, I was just trying to unmute myself.
Oh, no worries.
Yeah. So personally, I mean, I was just about to say that I'm not a good candidate to answer that question because I did this program when I was on my maternity break. So I did have a lot of time. So I would not be, an ideal person to answer that.
That's fantastic, though. We've had actually several women who have been on maternity leave and who have delivered during the course of the journey and have been using rooms at immersion and liftoff to pump. And so it's one real advantage of doing a leadership journey like this with all women also. So thank you for sharing that. I see that we have one hand raised in the audience. Sanjeevani, do you have a question for any of the panelists? Yes, Sanjeevani.
Yes, yes. Hello, ma'am. Good evening. My question is like that. Always, whenever we work, we give appreciation our juniors and colleagues and all that. But when it is regarding to us, so we feel like, means when we do the work, we think, okay, we are doing for only ourselves, for our happiness. But somewhere we require appreciation. So if that get, we will get happy. But when we will not get, we will little bit distressed. So how we can handle that? So regarding to that, can you just light on that?
Thanks, Sanjeevani. If I just want to make sure that I have understood your question correctly. Is it how to deal with setbacks or how to deal when you receive some distressing news? Is that correct?
But you are not getting whatever you are doing, but you are not getting back, means appreciation. I'm not saying that well deserve
Right.
appreciation. Huh.
Got it. You're not getting the acknowledgement for the work that you have.
Exactly.
Okay, great. Thank you, Sanjeevani. Pallavi, I saw you come off mute. Did you want to take that one?
I just want to ask one question to Sanjeevani on that question. Does she
Yes, ma'am.
appreciate herself?
Yes, ma'am. I appreciate myself every day, and that I will say, yeah, that I agree.
That is
I
the
do.
power that gives you the power to go back to the same world where you're not appreciated. That's it.
Yes.
You still do that work. You would have stopped it if there was no appreciation, but you still like that work. You still are doing that work.
Yes.
Correct?
Yes.
And whatever little appreciation you can gain from some other person, maybe, see, there could be other types of things that you could do. Like, I remember Millie said that she likes coaching, teaching. Get some other work along with the work that you're doing, which would be appreciative. And that power is going to make you come back to that work which you're not appreciated in. Are you getting my point? See, you are multifaceted. You can go ahead with doing a lot of things. So, Sanjeevni, where you get the power, positive power, do something on that front also. You can go back to the place where you're not appreciated, but you are needed. That is why they are not throwing
Yes.
you out. So that is an appreciation. That's self-appreciation. Sorry, I should not take it further. I think Millie also has a very beautiful hand up. So
Yeah,
Yes, I
thanks.
just wanted to
Go ahead, Nidhi.
say, to add on to what Pallavi is saying is, again, for me, it came with knowing who you are, where you want to go, which is what the leadership journey for me was. It was an unpacking of where do I want to go? How do I want to present at the workplace? What do I want to achieve at the workplace? And at the end of the day, having those, you can answer those questions for yourself, then you will not need external validation because you are validating yourself. I think that's why Pallavi said, do you love yourself? You're validating yourself. You're ticking off the things that you love to do. So for instance, I love to share my experiences, and I'm here sharing my experiences with the people who are on the webinar. They may not appreciate it, but you won't believe I'm going to be extremely happy that I have been able to share what I think would benefit one or two people in the audience. So if you can remove the external validation and focus on doing the things that you believe in, they are aligned to your core values, then even if someone else doesn't appreciate what you have done, you're still patting yourself on the back because you've achieved something that is aligning with your dream, with your vision, with your goals, and actually with your core values. Thank you.
agree with you, Millie. With you.
Thank
Great.
you, ma'am. Thank you very much.
Thank you. Thank you for the questions, Sanjeevani. We're just going to take two more questions, and I'm just going to ask one panelist, please, to respond to each of them, just in the interests of time. We have a great question that we often get about men. We all have men in our workplaces, and the question is, in a male-dominated workplace, how have you been able to navigate suppression, silent treatment, or even exclusion of your ideas by superiors? So would anyone like to take this question? Could also be more broadly about working with men in the workplace after the journey. Yeah, Kusum.
Thank you for the question. It is something that we all struggle with. This has come up often, even before I applied or went through this leadership journey. During the times I grew up, and my reflections have led me, and the tools, whatever we have learned during the journey, have led me to an understanding that the male dominance at the workplace is a result of centuries if, of decades and centuries of patriarchal setup in the society, and it's quite deep rooted. So there has been change, there has been improvement. 200 years ago, women were not allowed to have a higher education. Now we are all professionals with MD and PhD, etc. So change has been there, and yet there is a long way to go. So the understanding that this is deep rooted, this is present around us, this is what it is, accepting it in the first place, and then using subtle changes in the way we approach things at the workplace, taking it slow, again accepting that it will take a long time for things to change. and doing whatever we can in our capacity. I think those are some of the ways in which we can deal with the situation in a male-dominated space. Something as simple as ensuring that panels. I am not very active on X, earlier Twitter, right now. But there was a movement where academics were flagging manels. Manels are panels which have only male members on them. So something as simple as making sure that your organization, when when they are organizing an academic session, to just flagging the fact that there are no women on the team, or just suggesting an alternate female speaker. Small steps incrementally will make a difference. And we had a session during our leadership journey, which was about male allies. So identifying those allies and working with them really helps to sort of make yourself be included. So I recollect a quote from a famous feminist. I don't remember who it was, but it said, "If you don't give me a place at the table, I will bring my own chair." So that stuck with me, and I think these are some. Again, to sum up my response, it would be acceptance and small incremental changes to flag things and make things better for ourselves and for other women in the workspace.
Great. Thank you so much, Kusum. Just last question, also because we get this question all the time, especially from prospective applicants. It's about the leadership project. And so what is the role of the leadership project in this journey? Many of the applicants, as you may remember, panelists, from your application, you submit your leadership project in the application. So many of them may be thinking about that. So last question, what is the role, and for you, what was the role of the leadership project in your journey? Would anyone like to take this one before we wrap up? Pallavi, over to you.
So, self-empowerment for women empowerment. That was the whole thing. So, as I told you, I took up a challenging thing and I thought I'll not be able to do it. Still, I am on the way of doing it. So, I guess the role that the leadership project plays is very important. It changes your mindset. So, please have a challenging one, have an open one where you can learn lots of things like uh, finding your men allies. The first ally I found was my husband, that I'm going to get into this program and I need some space first move. So I guess leadership roles definitely that you need to take up, or your project that you need to take up, is something where you yourself can work on you and how you perceive yourself and how others perceive you. So make it such that you will be having some interactive role at a public health level also, where like Kusum said that it really helped her in her program where she had these interstate networks that had to be built, government and private. So I guess the same was with Millie and Jacqueline also, because she had something to do which was totally afresh and she pursued to do it. So I guess that is something which I would suggest that has a big role to play. And you can, when you see, you write something and then when you get involved in the program, you steer it much better. Maybe you just don't stick with the objectives there are, but you have more refinement of those objectives because of your mindset changing. Otherwise, you can say the leadership project is the same, but it just keeps changing. It becomes dynamic because you are getting dynamic now. You're not stubborn anymore. So I don't know whether I made myself clear or it was more
I love that, Pallavi. As you change throughout the journey, your project also changes and evolves. Thank you. Thank you so much. That's a lovely note to also end on. So thank you so much to all of our panelists for sharing your insight and your wisdom. This was a fantastic session with you all, and I'm so grateful that you all are in our community and are such strong advocates for the Women Lift Health leadership journey. And thank you to the audience. Some really, really wonderful questions. And I'm just going to turn it over to my colleague, Irene, to close out the session today. Over to you, Irene. Thank you. Irene, I think we're unable to hear you, or at least I am unable to hear you. Irene? I think Irene might be having a little trouble with her audio. One second, just technical glitches. I do know that oh no, we can't hear you, Irene. Try again.
Hey,
There you
sorry.
go.
Okay, is that better?
Yes.
Okay, sorry for that. I'm using some earphones. So once again, thank you to our panel. You guys are amazing. Thank you for motivating the women. I can see the chats coming in. I can see the questions coming in. I know for some of you, you have been asking questions. We will still respond to them. My colleague in the chat is going to, Purabi is going to be putting our email addresses. She's also going to put in our LinkedIn social, so you can be able to just connect with us, continue asking your questions. I will just reiterate on behalf of WomenLift. We do want to see change in public health, in global health. You are a means to doing that. Put that effort in your application. Put everything into that application. That is how we know who you are. Do not doubt yourself. If this is your first time, if it's your second time, go ahead. There's always opportunity. And other than that, we do offer institutional workshops that are tailored to you. So if you're finding that, yeah, you're in the journey, but you keep hearing from your networks, WomenLift, 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 contact us. Find out, you want us to deliver a tailored workshop? Go ahead. You want us to deliver in a professional association group? Go ahead. You have nothing to lose. And it's better to have tried and whatever the outcome does than to live in regret. And for us, we want you to understand that WomenLift here is always going to be championing women. That's why we have a tagline of when women lead, better health follows. Apply that in every aspect and continue engaging with us. Thank you once again for joining us. We appreciate you taking the time. We appreciate everyone being here, and continue following us on our socials. If you have a question, no matter how small or big, we are here for you. Thank you so much. And thank you, Sandhya and the rest of the WomenLift team, for making sure we were a smooth running engine. So we will release you and we'll still have a communication coming out after the webinar, maybe by tomorrow, just giving you the recording and just some more information about the application. Thank you so much. And it's good to hear that you're encouraged to join us.
Thank you.
Thank you, everyone.